Good morning, good afternoon, good evening, good night, or buenos días, buenas tardes, buenas noches, whenever you see this. My name is P. Silvera, and I'm sharing my project, Food Insecurity Mapping of Mott Haven of Community Board 1, uh, of which I did for my Community Health Worker Certificate Program, Social Determination of Health Final Project. In this collage, I show my certificate, the class I was in, um, and the event what I got from with my wonderful professor. As a person of faith, I started with Matthew 25, verse 35 of a contemporary English version states, when I was hungry, you gave me food to eat. When I was thirsty, you gave me something to drink. When I was a stranger, you welcomed me. In this scripture, Jesus challenged everyone to be compassionate to people who are struggling, affected to poverty due to social determination of health. During this past semester, when I took the class, I was challenged as I walk around Community Board 1. I talked to other community board leaders of food insecurity to who was hungry and based on social determination of health. Why people are hungry in a country that is supposed to be rich. This is a collage of me helping different um, organizations of me trying to, um, you know, try to help the food insecurity problem. I've done before, but this class kind of helped me um, looking in a different way. But based on food insecurity, I found different definitions for different um, audiences. But I like how the City of Harvest, which I volunteered, defined it uh, of saying of someone who don't have enough to eat and not knowing where their meal's gonna come from. Also learned that 50% New Yorker face insecurity, uh, and 50 working age household do not have enough to buy other essential. City Harvest is a humanitarian food um, organization. This is one of the supermarkets which I had to visit. And based on social determination, I put a picture of it's nice and nature with a low income, or also how the inside look and how outside look. Supermarkets like this um do not look like this in Manhattan. Manhattan really look better organized. Now, the I will go to the second point of the mapping. So the stores that I visit was association, supermarket, on 167th Street between Sheridan and Sherman. That's in my neighborhood of East Concourse. That's in Community Board 4. Also visit, which the price was $1, $9.79. But in Community Board 1, I visit Food University Marketplace. That was on 76 Melrose Avenue. The price is $2.99. Visit Food Town, 300 3rd Avenue. Price is $1.89. Aldi's was located on 300 3rd Avenue. What the price is of milk, $2.49. And Seatown, 2700 3rd Avenue, $2.89. And the Western Beef on 30 Morris Avenue, price is $3.29. When you also look on the map, the circles are all the supermarkets, and the small, tiny tunnel of the food, kitchen, and pantry. But this shaded area shows that there's a 10% of poverty went up. That the households was 221,423. And it also kind of shows that there's a lot of NYCHA. Whereas I said NYCHA is a lot of poverty, low income. If I could just summarize, based on the map optimization, while working around the neighborhood, I have discovered that my haven is a food desert. As described by clinical pharmacist Jessica Camporato, a Medical News Today review, she wrote, "Food desert are regions where people have limited access to healthful and affordable food. This may be due to having a low income or have to travel far to find healthy food options. Residents are not able to access option and opportunity because the community food stores located are so far apart. And the people around are middle to low income, especially those living in New York City housing NYCHA, which on the website described as affordable housing for low and moderate income New Yorkers. What is Community Board 1 of Mott Haven? So Mott Haven actually is the borderline of from 149th Street straight to the river, facing East Harlem. And his picture where community Tessera Diana. Association, Diana. Sorry. The Alexa officials that represent the community and the map So for Bronx representative, Bronx District Attorney, that's Shell Clark. For City Council, the representative is Deanna Ayala. District 8, that shares with East Harlem. The representative of State Assembly, Amanda Saperito, 84th District, and State Senator Jose Serrano, who know me since I was very young. The State Senate 29 was shared East Harlem. The statistics. So based on the statistics that I found, based on the New York University Farmer Center, Mott Haven is the highest in 2003 of all the boroughs, and citywide, 35% high. Income level, 34%, and the highest of culture is Hispanic. A problem that I see, yes, foreign markets can be an answer, but talk about foreigners, the closest ones are Bronx Borough Hall, that are located in George Kimmel Park, but that's Community Board 4, and people know about that. Another is Lincoln Hospital, but that is north of Mott Haven. And another one is St. Mary's Park. Again, it is north. What about the people who are south of Mott Haven, like the seniors? Another issue I found was the Mott Haven fridge. During the pandemic, community fridges was the answer. Neighbor helping neighbor. But when I came to 149th Street, 144, and St. Anne's, there was no food, freezer, order, and it was dirty. You would not find this in Charles Neck and in Riverdale. Community Board 1 does food distribution, but with community associates, Deanna did share me that in May, 357 families were served, but it's in Melrose. Again, the neighbor above Mott Haven. We do have businesses that do pop up food distribution. Camille, girl from Bronx native with the food, which is a clothing line store. He partnered with grassroots groceries to give out food. And when I spoke to him, I gathered him. He said that to where the store is at, right next to the bridge, 3rd Avenue Bridge, there's no supermarkets around. This is my citation resources. Thank you for my time.